Well, growing up, did your mom ever tell you how important it was to take care of your skin?
You know, I don't think mine did, but I love her anyway. And for this mother and son duo, skincare isn't just a priority, it is a necessity. Skincare maintenance is a trend that Dr. Richard and Dana LeConey from the Institute of Anti-Aging are seeing more and more with their patients.
And they are joining us now with mother and son duo, Amy and Michael. Welcome to the show, everybody. This is great, super exciting, and I know we have a lot to get to. And we are talking about sort of, do you guys see the mother-son duo, mother-daughter duo happening a lot in your office?
Yes,
Yeah, very
we're seeing
definitely.
a lot of it now. Yeah. You know, because our parents taught us baby oil, iodine, and all that. And today, mothers are really, you know, they're bringing in their teenagers, and yeah.
For a lot of folks, I mean, I remember the first time I heard about this idea that it's about prevention, right? And younger people getting Botox, getting fillers. I thought it was all baloney. But explain to us why this is a strategy that you've seen to be really effective in your office.
Well, it definitely is. You know, Botox, of course, is all about prevention, because if you can get involved before the wrinkles form, then you can keep them from ever forming. As long as you do it consistently, those wrinkles of facial expression just will not form.
Genius. Okay, well, let's chat about Michael, because your face looks flawless to me, but I think...
Chiseled.
Chiseled, right? Straight from a Disney film. Do you have a before photo that we can see? What was the thing that you...
What bothered you? We don't see it.
Well, let's see. The lines across my forehead, and I wanted bigger lips, a more fuller smile, and I definitely wanted bigger cheekbones, that chiseled. You know.
Wow.
Yeah.
Okay. Well, I think it worked, but Dr. LeConey,
Yeah, we did
explain what you did.
Well, of course, yeah, we put a little bit of, you know, filler of Voluma right here, Juvederm Voluma, on each side, just to kind of give a slightly wider and bigger cheek arch, which is very becoming and kind of the thing. And of course, we did a little Botox. We'll do a little bit more today. And what else have we done?
The lips. We did.
Oh, that's right, the lips.
Just a couple days
ago. How could I forget?
Okay, so just a couple days ago, and you see no bruising. This was the in-office treatment that you have. So and what's interesting about fillers is that the results show immediately, as you're seeing when the injection is going in.
What you see is what you get. Great instant gratification type of treatment.
And just a couple days, if you just look straight into the camera there, perfect. Look at that, no bruising. The lips look amazing. Okay, now we're going to go with a little Botox. So we can't have Michael talk, but we're going to have Dr. LeConey start with this. And this is all about prevention. So he does quarterly Botox in the forehead and then around the eyes. I hate saying
And quarterly is about right. Some people can make it stretch a little longer, but the idea is you want to keep those muscles weaker, not absent so you don't look like a mannequin.
Right.
But you want them weaker so they don't crease the skin.
And that's the point.
concept.
When we're doing the injection now, as you can see, this is preventative. So you're not having those deep set lines later in life. You're able to kind of age gracefully where they're not going to be set, you know? I mean, everybody wants to have a little bit more crease-less.
Of course. Dana, is it true, too, that the earlier you start doing Botox, the less Botox you need over time?
That's true, because you're breaking that muscle memory.
So the muscle just forgets to crease. Yeah. And when that muscle is contracting, that's what's breaking down the collagen and causing the creases, right?
And so now he's going to put a little filler inside that crease on the bridge.
Now, Michael was concerned about this little area here because he sees it getting deeper. And, you know, with Botox, it'll minimize that because this is one of the motions that we're going to interfere with the Botox. But still, there's a little bit of a line there that's already started. So we can come in here and just put a little bit of this dermal filler. Hang in there, Mike. You're doing great.
And as part of Michael's maintenance plan, we mentioned that he does the quarterly Botox. The fillers, though, they last a lot longer. That only happens once a year. So it's sort of like getting a tooth cleaning, a teeth cleaning, right? When you go to the dentist and get a cleaning, do that a couple times a year.
It's my annual checkup. Yeah.
Annual checkup. All right, let's chat about Mom over here. Amy, again, you look flawless to me, but what were some of the things that you wanted to have fixed?
I just liked more of a maintenance look. I don't like to have a lot done at once. I just like little, but what I like to have fixed is more my lines, my crease, my frown lines, I think are real important to women. We kind of droop.
So before you had more of a crease above
and they're
your
going to
lip.
fix, right. And they just did that a few days ago and filled me, so I'm still a little swollen.
Don't look swollen to me.
But
No, not at all. And so, go ahead.
There's new techniques that minimize bruising. One of them is the use of the cannula and things like that. So,
Right, and that's the smaller needle, basically, of what you're using,
Basically,
right?
yes, right.
Okay, and here's the in-office of what happens. So that's around the lips and then around the cheek area. And this is your routine. So you do quarterly Botox for forehead and crow's feet, and then the annual fillers, of course, and also a monthly hydrofacial and dermal infusion, which is super important to keep that skin healthy and
that
clean.
glow to your skin.
I think I do a hydrofacial weekly.
Oh my gosh,
Really?
weekly.
She's trying.
And just go for it.
So
Dr.
here we
Lee.
go. We're going to put a little bit, we're concerned is a little bit of the depth here, the smile line. So we're just going to put a little tiny bit of the dermal filler right in here.
And as you're doing this, Doctor, Courtney and I want to just fully disclose that we're huge fans, because not only from the hydrofacials to the Botox, but you guys have, a couple weeks ago when I was sick, you guys gave me the B12 shot, prevented my, full-blown cold that wanted to happen.
Absolutely.
Now see how that de-accentuated that crease right there? It was very sharp. There's still a crease here because that's natural. People
Right.
have a fold here. But what we did was we just kind of softened it, made it a little bit less noticeable. I think it looks
Look
great.
Yeah, absolutely.
All right, guys, thank you so much. Again, antiageinstitute.com, or you can call 713-807-1000. Courtney, didn't you get a little Botox before the show today?
I mean, a little BSB, never hurt anybody.
Not a joke. Not a joke.
Botox backstage.
Guys, you look great.
Thank
you
you,
so much
thank
for coming
you.
by.